Hi, my name is Hadi Zambarakji. I'm going to talk to you today about diabetic eye disease. So how does diabetes affect the eye and why does diabetes affect the eye? So diabetes is, as you know, a very, a common condition or a relatively common condition. And we know diabetes affects the blood vessels and it makes these blood vessels much more leaky and it makes the circulation, it compromises the circulation and therefore causes vascular, the vascular disease component of diabetes means that the tissues in the body don't get enough blood supply, enough oxygen, enough nutrients. So diabetes causes diabetic retinopathy, which means it affects the retina. And it does so because it affects the blood vessels and because the retina is supplied by blood vessels. Diabetes also causes cataract. Diabetes also increases the risk of glaucoma. So the first question really is, what should the patient expect? Well, first of all, patients are diagnosed with diabetes either at an early stage in life or later on in life, but sometimes somewhere in the middle as well. The key thing is to understand, that the earlier you've been diagnosed with diabetes, the longer you've been diabetic for, the more likely you are to have diabetic retinopathy. And this talk is going to be specifically about retinopathy. So if I see someone who's been diabetic for a long time, I'm expecting to find some degree of retinopathy. What is retinopathy? Retinopathy is when the retina is affected by the diabetes. When I look at the retina, I will see maybe hemorrhages, maybe what we call exudates, which are signs of leakage. I might see signs of poor blood supply on the retina, which we call cotton wool spots. And in the very advanced stages, I might see abnormal blood vessels growing on the retina. And that's really quite serious if it gets to that stage. The key thing here is that all these things are treatable. It is very treatable, and there is really good data and good evidence that if you keep your sugar under good control throughout the time since you've been diagnosed with diabetic, then you delay and you probably prevent the development of these complications quite markedly. So sugar control is absolutely key to all this. Control of the blood pressure is very important. Control of the cholesterol is very important. Eating the right things, eating the right diet is absolutely critical. Avoiding smoking is absolutely essential. To get back to the issue of diabetic retinopathy, there is this condition called macular edema, or diabetic maculopathy, which also can affect vision in diabetic patients. This refers to the leakage into the retinal structure. So think of the retina a bit like a sponge. If the vessels that supply the retina are leaky and the retina is backed like a sponge, that sponge is going to swell. As that retina swells, which we call macular edema or clinically significant macular edema, then that will affect the vision. So, and this is treatable as well, treatable with usually laser or injections, more commonly injections these days. Back to the point that I made earlier, good diabetic control, avoiding all the other things I discussed earlier, like smoking and eating the right things, are critical to ensure that you don't develop macular edema and diabetic retinopathy. So in a nutshell, vision can become affected in diabetic patients if there is either macular edema or severe diabetic retinopathy. The other thing that can affect vision in diabetic patients is hemorrhage inside the eye. Hemorrhage, why does it happen? Well, it develops because if the patient has got as far as developing abnormal vessels on the optic nerve or the retina, as I mentioned earlier, in advanced diabetic retinopathy, then these vessels are friable. They will bleed, they will easily leak, and if they bleed, then the patient will present with a vitreous hemorrhage or a hemorrhage inside the eye, which again is treatable, but this then requires surgery. So obviously you don't want to get to that stage. The point of all this is that we want to treat patients early. We want to make sure that their sugar is well controlled from an early stage in order to avoid these late onset complications. I didn't go as far as talking about more serious complications like glaucoma, like retinal detachment, like rubeotic glaucoma as well. But these are really quite advanced conditions which we obviously want to avoid. And unfortunately, we still see such complications in diabetic patients. And that's simply because we're either not picking up the patients early enough, or they're not getting the treatment early enough, or they've been poorly controlled for too long and therefore allowed their diabetes and their retinopathy to get to that sort of stage. So once again, the key thing here is pick it up early, avoid the things that make sugar control poor, ensure your sugar is well controlled, and treat your diabetes. And if there is retinopathy, it is treatable if picked up early, and that's the key thing. Once again, early treatment, early interventions. Thank you for listening.